Let's continue with interviewing the patient, this time on temperature. This area of inquiry is used to determine how deep the pathogenic factor has penetrated into the body and whether the imbalance is hot or cold in nature, as well as to identify yin and yang imbalances. It is important to point out that in Chinese medicine, the presence of heat in the body is determined by the patient's subjective perception of their body temperature or by the practitioner's physical palpation of their skin and their observation of skin color changes. This means that even if a thermometer reading says that they do not have an increased body temperature, if they themselves feel that they are warm or have a fever, or if the practitioner can feel that their skin is hot or see that the face it is red, then there is heat, even though it cannot be measured physically by the thermometer. On the other hand, if they do have a measurable rise in body temperature, this is always a sign of heat. If a person feels cold or has an aversion to cold, it is important to ask them if they can get warm again by putting on more clothes or wrapping themselves in a blanket. If the increase in clothing or bedding makes them feel warmer, this is yang deficiency cold. If they are yang deficient, they will have difficulty maintaining the warmth of the body. But by packing the body into warm clothing, they reduce the heat loss and no longer feel cold. If they have an invasion of exogenous pathogenic factor, which blocks the circulation of Wei Qi, they will not be able to get warm again, even though they put more clothes on or lie beneath a duvet or blankets. This is because Wei Qi, as well as protecting the body and controlling the sweat pores, warms the muscles just below the skin. When the pathogenic factor invades the exterior, the warming Wei Qi is blocked and cannot circulate. This means that it does not help to increase the amount of clothing or bedding that is insulating the body. The pathogenic factor must first be expelled so Wei Qi can circulate before the person will feel warm again. When pathogenic factor is in the exterior as well as feeling cold and chilly, the person will often have a slight fever or feel feverish. This is because the exogenous pathogenic factor will not only prevent the circulation of the warming Wei Qi, it will also give rise to a conflict with and a stagnation of Wei Qi, resulting in the generation of heat. The difference between wind cold and wind heat is that in wind cold, there is a greater aversion to cold and little or no fever sensations, whereas in wind heat, the fever sensation is more predominant and the aversion to cold less noticeable. When exogenous pathogenic factor has penetrated the yang ming aspect, it will generate a great amount of heat. This is because there is a violent struggle between the body's Chen Qi and the invading pathogenic factor. One of the most important diagnostic differentiations between pathogenic factor that is in the exterior and pathogenic factor that is penetrated to the interior is the strength of the heat and whether there is an aversion to cold. When pathogenic factor is in the interior, it no longer blocks the circulation of Wei Qi. This means that the person no longer experiences chills and muscle soreness. The fever, on the other hand, will be much more virulent. If the person experiences alternating fever and chills or an alternating sensation of heat and an aversion to cold, this will indicate that the pathogenic factor is located in the Shaoyang aspect. Qi can become lodged in this hitch between the interior and the exterior. This results in symptoms that alternate between these two stages. Internal heat conditions can give rise to an aversion to heat, but it is not certain that the person is aware of it. Often, if you ask them how they feel, they will say that they do not have an aversion to heat or feel hot, but you can often observe that they are more lightly clad than others. A major difference between deficient and excess heat is that When there is excess heat, there is a sensation of heat throughout the day. When there is yin deficiency heat, the person will only feel warm in the evening and at night. Again, it is not certain that the person is aware of this. They do not think about whether their duvet is thinner than other people's or that they feel warm at night. Furthermore, a person with yin deficiency might not answer yes to feeling hot in the evening because they are sensitive to cold during the day because they are also yang deficient. In the evening and at night, they just feel less cold and perhaps remove the jersey that they have worn all day. Another difference between deficient and excess heat is that when there is excess heat, the whole body feels warm. When there is yin deficiency heat, the person can experience what the Chinese call 5-pound heat. In 5-pound heat, it is only the palms of the hand, the soles of the feet, and the center of the chest that feel hot. Many European patients rarely report a sensation of heat in the chest in these situations. There are also many yin deficiency patients who only feel the heat in the palms of the hand. It is important when differentiating between deficient and excess heat to ascertain whether it is the palm of the hand, yin deficiency heat, or both sides of the hand, excess heat that feel hot. A person who is qi deficient can have difficulty controlling their temperature. Therefore, they may well experience an increase in temperature on exertion. Cold hands and feet can be a sign of many different patterns of imbalance. One of the most common causes is liver qi stagnation. When there is liver qi stagnation, there is sufficient heat in the body, but the warmth cannot circulate out to the extremities. The difference between liver qi stagnation and yang deficiency is that when there is liver qi stagnation, it is only the hands and feet, and sometimes only the hands that are cold. When there is yang deficiency, it is the entire arm and leg that feel cold. The arm or leg will also feel increasingly cold the further you get from the torso. Blood deficiency and qi deficiency can also manifest with cold hands and feet because the warmth does not get transported from the torso. When a person has cold hands and feet, they might say that they feel cold or have an aversion to cold. This can create confusion when there is in reality a diagnosis of heat. One would expect that a person who has heat would feel hot, have an aversion to heat, or at least not say that they are cold or dislike cold. If they have liver qi stagnation, which may well be the underlying cause of their heat, their cold hands and feet mean that they have an aversion to cold and feel cold, whilst in reality, the body itself is warm. Now let's summarize what we have taken up. If one has aversion to cold, it signifies excess cold or yang deficiency. If there is an invasion of exogenous cold, the person will freeze no matter how much clothing and blankets they wrap themselves up in. In yang deficiency cold, the person can keep warm by wrapping themselves up in warm clothes or bedding. Aversion to heat signifies heat. Simultaneous chills and fever signifies invasion of wind heat or wind cold. If there is wind heat, the fever will be dominant. If there is wind cold, the chills will be dominant. Prolonged or intense fever indicates internal excess heat. Fever that arises in the afternoon or evening signifies yin deficiency heat. A feeling of heat that arises on slight physical exertion is qi deficiency. Alternating fever and chills means that the pathogenic factor is located in the Shaoyang aspect. 5-pound heat, hot sensation in the palm soles of the feet and chest, signifies yin deficiency heat. And finally, cold hands and feet means liver qi stagnation, yang deficiency, qi deficiency, blood deficiency. Thank you for listening.